lenticulostriate stroke. This is regarding the lenticulostriate outlet. Hypertension can cause lipohyalinosis, which is fancy word for microatheroma formation of small lenticulostriate outlet. Ischemia within this small vessel leads to necrosis and reabsorption of tissue, leading to lacuna. Unlike large stroke, lacunar infarction often do not present with cortical deficit like aphasia, neglect, or visual field losses. Instead, they manifest as specific syndrome based on their location, such as pure motor hemiparesis, pure sensory stroke, or ataxic hemiparesis. Just the mechanism is hypertension by causing lipohyalinosis. This is regarding the lacunar infarction of the lenticulostriate artery. Aneurysm, microaneurysm of this lenticulostriate artery within cause hemorrhagic stroke and intracerebral bleed. So, lenticulostriate artery can cause lacunar infarction or microaneurysm called shock push-out microaneurysm, which is susceptible for hemorrhagic stroke and intracerebral bleed. Neuronecrosis. Necrosis of nervous system tissue is called liquefactive necrosis. Acutely, the ischemic infarction of CNS. What's happened is with neurons, which is a strong eosinophilic staining with H&E. This is contrast to MI. MI acutely no histologic change. Regarding microglia are the resident macrophage of CNS. They phagocytose necrotic brain or spinal tissue. Astrocytes are the glial cell that proliferate and become a glial scar, gliosis. In other words, if they ask which is responsible for scar formation CNS, it is the astrocyte. Regarding Wallerian degeneration and what's about regeneration? Degeneration is referred to degradation of an axon myelin sheath distal to the site of injury. Regrowth occur at the maximum of 1 millimeter per day. That's regarding degeneration. Both peripheral nervous system and central nervous system undergo Wallerian degeneration, but regeneration occurs within peripheral nervous system, not the central nervous system. This is because the Schwann cell can regenerate, but oligodendrocytes of CNS don't effectively regenerate myelin post-injury. The optic nerve is considered an extension of CNS as myelinated by oligodendrocytes. This is why the other cranial nerve are part of peripheral nervous system and myelinated by Schwann cell. This distinction is why degeneration of the optic nerve results in permanent blindness, where of other facial nerves such as cranial 7, which Bell's palsy, can regenerate. However, the extent of cranial nerve recovery depends on the nature of the injury and is not always complete. The same way nerve injury in limbs might not fully recover either. So degeneration occurs in both, but regeneration is best